studying all night. Real stressed out about this test.
Yeah, you getting enough sleep?
Well, not really.
Do you know what just happened there? Me neither. But hang out to find out. Hello, my people. My name is Trip McNeely. You might remember me from such medical videos as the diabetes. Today, we will embark on another journey, accompanied by my friend and esteemed colleague, Charles Smithers. Hello. Together, we are going to guide you through an incredible journey that will include talking with a resident expert, following up on that case.
And we have an interview with an actual epileptic.
So let's start this off by going to Yaritza Quinones to tell us exactly what just happened and what is a seizure.
A seizure is a sudden, uncontrolled electrical discharge of neurons in the brain that interrupt normal function. Epilepsy is a condition in which a person has spontaneous, recurring seizures caused by chronic, underlying conditions. Seizures are often symptoms of an underlying cause and result from systemic and/or metabolic disturbances. If seizures cease when the underlying problem is corrected, it is not considered epilepsy. The cause of epilepsy has been linked to a group of abnormal neurons known as seizure focus, which are your brain cells that seem to undergo spontaneous firing. This firing spreads by physiological pathways to involve adjacent or distant areas of the brain. If this activity spreads to involve the whole brain, a generalized seizure occurs. The factor that causes this abnormal firing is not clear. Any stimulus that causes the cell membrane of the neuron to be polarized induces a tendency to spontaneous firing. Often the area of the brain from which the epileptic activity arises is found to have scar tissue called gliosis.
Man, seizures sound like they're no bueno.
Yes, if you have a seizure disorder, there's much to know and more to find out.
Huh, it's crazy. Let's go back to Yaritza and see what else there is exactly to talk about seizures.
Seizures are divided into two major categories, generalized and partial. Partial seizures are also referred to as partial focus seizures, which are caused by focal irritations. Generalized seizures involve both sides of the brain and are characterized by bilateral synchronous epileptic discharges in the brain from the onset of the seizure. The most serious complication of epilepsy is called status epilepticus. This is a state of continuous seizure activity or a condition in which seizures reoccur in rapid cessation without return to consciousness between seizures. Most seizures do not require professional emergency medical care because they are self-limiting and rarely cause bodily injury. However, if status epilepticus occurs, significant body harm occurs, or if the event is a first-time seizure, medical care should be sought immediately.
Some bad business is going on there.
Yes.
Two different types of seizures, huh? Did you get that?
Two categories.
What were they?
Partial and general.
And that status epilepticus.
That's no bueno, as you would say.
No bueno.
We're gonna go check out that first patient now and see what's going on at the clinic.
Let's go.
Yeah, sports. Hello?
Hi, fellas. How are you doing today?
Had better days.
Good. Yeah, true.
Okay, well, who's Brennan?
I'm Brennan. This is my stepbrother,
Dale.
Dale.
Okay. Nice to meet you guys.
You too.
Nice
to meet you.
Nurse Hawthorne?
Nice.
So what brings you in?
We think he had a seizure.
Okay.
So
Can you describe it to me? Alright, do you remember anything
I
about the
remember,
episode, or did you black out? And you were really tired afterwards?
Yeah, thirsty too.
Did you have any muscle soreness or?
Not really.
Alright, well, do you have family history
Seizures?
of seizures?
Yeah.
My mom, yeah, she's had epilepsy.
And this is the first time that this has ever happened? You haven't had any other episodes that you can remember? Alright, well, how was growth and development? Everything was pretty normal as you were growing up? You've never had any head trauma?
No head trauma, no.
Alright, well, do you have any other problems? Do you have liver problems, renal problems? Well, that's good. Well, we have some tests that we need to run, some blood work and probably a urinalysis and some other things that the doctor may order. So you just hang tight, okay?
Alright. Yeah, come in. Nurse Hawthorne.
Hi, Brennan. Dale. Well, we didn't find any underlying causes that could have made you have a seizure.
So this could be epilepsy?
It could be. If you have any more, it could be, yes.
How could this change my life?
Yes, that's a good question. How does it affect your life?
That's a good question. Let's go back to your Ritz and find out.
Perhaps the most common complication of seizure disorders is the effect it has on a patient's lifestyle. The patient may develop ineffective coping methods because of the psychosocial problems related to having the seizure disorder. Although attitudes have improved over recent years, epilepsy still holds and carries a social stigma. The patient with epilepsy may experience discrimination in employment and educational opportunities. Transportation may be difficult because of legal sanctions against driving.
Sounds terrible. You know what? Why don't we dig a little deeper into that? I think it's a good time to go to that interview you had.
Let's go to the interview and hear firsthand the effects of a teenager's life and a young 20-year-old son patient. This way.
No, this way.
I was 15. I remember that I dyed my hair the night before, so we thought that pneumonia was the trigger for it.
Yeah.
And I was in the shower the morning after when I had it. I remember they had to kick down the door.
Wow.
Which was really, I guess, scary for them. Because it was locked. I was bruised up and everything. I remember thinking I had a date the weekend, and I remember thinking, oh my god, I missed it. I don't know why, but that's what I thought. And, going DMTs to get me. I was just really confused about the whole thing, crying, like that. Okay. Well, I can't drive, for one thing, which means that people have to bring me to work or to run my errands. So I have to take the bus or walk. So I feel like I'm a burden to other people. I feel like I haven't been able to grow up. I don't feel like I'm 25. I feel like I'm, a younger 21. It has to be somewhere really close, something I can get to really easily. I have a bachelor's degree, and I haven't been able to find anything because it has to be, like I said, really, really close. And I've seen jobs that I probably would have been able to apply to, but they're just way too far away. So I guess I'm not having much luck in that area right now. I guess I'm stuck with minimum wage right now.
So, why don't gonna go back and see how that case follows up.
Okay, I don't see why not.
Let's go.
Hi, fellas.
Hey,
How's it going?
good.
How are you feeling today?
Feeling good today.
Today's
Good. Today's a good day.
Yeah.
Alright, well, I've heard you've had more episodes.
Fortunately.
Right, okay, well, the doctor has prescribed this for you. You want to make sure that you stay compliant with your medication.
Okay.
Okay,
I hope this
because,
helps. Yeah.
well, it's not going to cure it, but it'll prevent them. I need you to report any adverse side effects immediately to the doctor, okay?
Okay. So
They
the
may
side
need to
effects
change
here.
it.
Okay.
And if you continue to have seizures while on this medication, they may need to change your dosage,
Okay.
So make sure you get lots of rest, you eat right, and you continue to exercise,
Okay.
okay?
Thank you.
Any questions?
No. Take it from here, me and Dale.
Okay. Well, it's nice meeting you both.
You know, Trip, I'm real curious. Curious, I say. I need to know more about possible drug therapy solutions for these seizure disorder patients.
I got just the person
Okay.
that we can ask about that. Let's go check it out.
Yes, hello. My name is Dr. Onk. I'm here to talk to you about seizure drugs. The seizure disorders are primarily treated with anti-seizure drugs. Therapy is aimed at preventing seizures because, unfortunately, the cure is not possible. Proper medications control about 70% of all seizure disorder cases, and that's pretty good, eh? The primary goal of anti-seizure drug therapy is to obtain maximum seizure control with a minimum of the toxic side effects. Oh, some of the anti-seizure drugs that I see a lot are Dilantin, Tegretol, which are used for treating the generalized and partial seizures specifically. Also, I have seen the Neurontin, Topamax, which are pretty broad spectrum along the lines of the seizures. When giving these drugs, be observant of the side effects. These commonly include drowsiness, ataxia, diplopia, and the rashes on the body. Because of these side effects, sometimes the patient will not keep taking the medication.
That was great.
Excellent.
I don't know about you, but I know that I definitely learned something today.
Yes. Control those seizures.
Or they will control you. This is Trip McNeely.
Charles Smithers.
It's been a pleasure.